With Momsavinggrace, I'm here with Dr. Derek Nelson, a chiropractor in the Watauga area. Did I say Watauga right? You know I'm not from
You said Watauga. Right?
Okay. I wanted to interview him because there are so many people that have misconceptions about chiropractic care. It's been real integral to the recovery in my health, and there's such a large scope of practice of chiropractic care. Good Lord. So I wanted to sit down and talk with him kind of about his journey into chiropractic, but he's also has a degree in many things. Talk to us a little bit about what all the scope of practice incorporates, and so people know what services that are offered with chiropractic care. So if you could start there, talk about a little bit about your journey into how you got into chiropractic.
Absolutely, yeah. So going through undergrad, I didn't really know what I wanted to be when I grew up. I'm still kind of questioning that and trying to figure it out, but doing my undergraduate degree in kinesiology, exercise science. And during that time, I'd always seen a chiropractor. It wasn't until I found out that the head director for the Olympics, for the previous 3 Olympics, had been a chiropractor.
Wow.
That's when I decided, hey, this is the route for me, because I wanted to work with athletes and kind of specialize in the sports medicine realm of things.
Okay. So chiropractic world, are there specialists in different areas?
Absolutely. So, we have general chiropractors who kind of do what we call like a family practice, which would be your general practitioner kind of as an equal for Western medicine. But there's chiropractors who specialize in kids, in pediatrics, and mothers, and prenatal. And then, like myself, I specialize more in sports medicine. We even have some functional neurologists, which are doing some great work with some brain trauma injuries and things like that. So, functional medicine, which is focusing more on nutrition as well. So there's tons of different specialties. There's tons of different techniques. And that's all something that you need to understand when you're choosing a chiropractor, so you can choose the right one for you and your ailments.
Okay, and so tell me a little bit about your specialty.
Absolutely. So going through chiropractic school, wanted a little bit more, so I actually ended up studying functional medicine. So I went for a master's degree at the same time of going through chiropractic school.
Derek, tell them about what's functional medicine, so for those who don't understand.
Yeah, absolutely. So functional medicine is trying to look at the root cause of the issue within your body. So instead of just giving that Band-Aid or that aspirin or whatever it is that's going to just kind of mask the symptoms, we're trying to figure out what's going wrong nutritionally or in your lifestyle. It might be something that, too much pollution from outside. So whatever it is, we're trying to figure out what that is so that we can, either eliminate that or we can supplement the proper nutrition for you.
Okay.
An easy example of this, vitamin D. It's a huge precursor to a lot of different hormones, and it can actually lead to muscle aches. So if you're having muscle aches, you might be going to your general chiropractor going, man, I'm really achy right here, and no matter what you do, you don't get rid of it.
Right.
When it could just be a vitamin D deficiency.
Wow.
So that's what functional medicine is looking at. So through chiropractic school, I ended up receiving my master's in functional medicine. Again, this was all part of my master plan because I wanted to be well-rounded in fitness, nutrition, and chiropractic. There, I ended up going to school for another master's in sports science and rehab.
See what I mean? Okay, so tell us about some misconceptions. People that come to visit you or hesitate. What are some misconceptions people have about coming to see a chiropractor or the care that you all provide?
Yeah, absolutely. So I think the biggest one that we need to address first off is our education program after undergraduate degree. So your general 4-year degree is 3.5 years. So it's about the same time as med school. Our first 2 years are primarily spent doing your basic anatomy. So we do the same gross anatomy labs that medical doctors do and all that good stuff. And then, where medical doctors will go into pharmacology, we go into manual therapies. Okay. And physical therapy modalities and things like that as well. So the biggest misconception, and I've heard, didn't you go to a weekend course for this? Yeah. Like, man, I wish it was that simple. Like, that would be really cool. Right. And that would have saved me a lot of money in student loans too. But so our education, it's pretty in-depth. We're anywhere from 21 to 34 semester unit hours a semester. So it's very fast-paced. It's a well-rounded education as far as not just musculoskeletal, but actually internal organs and things like that as well. So that's the biggest misconception that I get from the education standpoint. The weekend course one, that one kills me every time. But yeah.
Is it a certificate? No, they don't hand out doctors for
Yeah, exactly.
An online course.
Exactly. And that's another thing too, it is a clinical doctor degree. It's different from like a PhD or a doctorate. The next biggest misconception misconception I get is, you know, I heard Sally got hurt seeing a chiropractor. Or, you know, oh, I hear this one, somebody died seeing a chiropractor. You know, those are so far from the truth. And generally how I tell people this is, my malpractice a year, I'll be straightforward, I'll tell you guys, I pay like $1,000 a year for malpractice.
Wow.
Go ask your general practitioner how much their malpractice is.
Try tripling that a month.
Yeah, exactly.
It's exorbitant.
And then talk to a surgeon, talk to an anesthesiologist. So
that shows you the risk involved.
Yeah,
That's
exactly.
why it's so cheap.
Exactly.
Right.
And you know, insurance companies are for profit, so they're not going to charge me $1,000 a year if I'm hurting people.
Right.
If chiropractors are hurting
That's
people.
That's a good point.
So it's very safe. You know?
Okay, so for those who have absolutely no idea, what's an adjustment? What does that mean?
Yeah, adjustment is a restriction in the range of motion, the normal range of motion of your spine or any joint in your body. So all we do is we simply just place you in a position that's going to allow us to create that motion in that body. So if that joint is supposed to move like this, but it's only doing this, we just put you in that motion, create that motion, and then that actually sends signals up to your brain to help relax or change the tone of the muscles.
Wow.
And that actually helps you feel better, you know, immediately and, you know, for a prolonged period of time as well. Because I've had patients or friends or family tell me, hey, are you going to align me? No, you are not a vehicle. You're not a car. I'm not going to align your tires. So an adjustment is a restriction of motion, right? So we're putting motion back into the spine or whatever joint in your body it is. We're not literally taking a crooked spine and putting it straight again. So that's a really big misconception. And, you know, it's just a use of words, right? You know, you could use alignment for saying, oh, we're just getting things moving again, but yeah, we're not going to straighten you out. We're creating that range of motion. We're changing things neurologically more than we are changing things actually mechanically or anatomically.
Yeah,
absolutely.
Okay, so how does it happen that people lose range of motion between those joints? Is that just trauma? Is that just postural thing?
Great question. Yeah, for the most part, it's trauma, right? And again, most people, when they think trauma, they think that car accident or that slip and fall. But again, trauma can be repetitive in nature as well. So muscular imbalances, right? So if we have that forward slouch posture, these muscles are going to be tighter. They're going to be pulling on your thoracic spine, your mid-back. So that's going to create restrictions in that range of motion. So what we do
so when people say, well, what's the big deal, I slouch, but what happens when we do that? You know?
Absolutely. So you actually shorten these muscles here in the front, which can cause these muscles to get bigger, and then you actually have a bundle of nerves and blood vessels that go through here. So if these muscles get restricted, you can actually start to get numbness and tingling down into your hands, which is something called thoracic outlet syndrome. So having poor posture, you know, can turn into a serious ordeal. I had a patient who had it so bad that we couldn't get it under control, and she actually had to end up having surgery and you know, part of her muscle removed just so that they can you know, get that feeling back into their hands. So you know, posture is a huge thing. Not only that, it affects breathing as well. So in here, you can't open up those lungs as well, even though you should be belly breathing anyways, but you got to be able to open that up so that, you know, everything works and functions how the body's supposed to be.
Okay, wow. You know, and I think you raised a good point is you had a patient that you couldn't, it didn't resolve, and that you're a good enough practitioner to say, okay, white flag, you gotta go see somebody. And I think that's what's important for people to understand is you have to choose somebody right, someone who's going to know, you know, the limitations of what they do and when it's not working, to not just keep charging you to come and have an adjustment or whatever, you know, whatever they're doing with you, to say this is something else, you know, that whatever.
And another misconception I hear a lot too is once I see a chiropractor, I have to see a chiropractor for the rest of my life.
Oh yeah.
I hear that one a lot, especially from people who've never been to a chiropractor. A good chiropractor, a good practitioner of any brand, right, should have an end date in care.
Agreed.
Right?
Yeah.
So if I see you and you come in here, your little finger's hurting, I assess you, I figure out what's going on with your little finger, I figure out a treatment plan. Hey, I need to see you 3 times for that little finger. We'll get that little finger feeling a whole lot better. Okay. So we have an end date in mind. If your practitioner is not giving you any end date in mind and they're saying, hey, you need to come 3 times a week for the rest of your life, essentially, you know, in my opinion, I would not go to that practitioner. you should be feeling better, and you should be feeling better, fairly quickly.
Quickly, yeah.
Because, most all conditions do have a natural history where they're going to start to feel better on their own. So what we're trying to do is we're trying to make sure that it not only feels better, but it feels better quicker, and then it also heals better, so it's not going to create an issue down the line.
Okay, long-term issue.
Yeah.
Right. Mm-hmm.
No, and that also brings up the fact of like maintenance and things like that. So a lot of people will see chiropractors just for general like monthly adjustments.
Right.
It feels good. If you've never had an adjustment before,
it's great.
Yeah, it feels really good. So some people choose to come to us just like they would, go get a massage, just because it feels really good. It's therapeutic. It's not gonna hurt you. But again, you shouldn't choose a practitioner who wants you to rely on them.
Gotcha.
You need a practitioner who's going to teach
wants you to restore you to health.
Exactly.
Right,
who's going to teach you the proper exercises, the proper nutrition, the proper stretching, so that you can take care of yourself. Truly, doctor means educator. If your doctor's not educating you, in my opinion, again, you need to find a new doctor.
Agreed. Think that they're only concerned with muscles and joints, but I know that people can go to certain chiropractors to have their children adjusted for reflux, for colic issues, for ear. I had a son that had repetitive ear infections. Went to a chiropractor to get their ear adjusted, no issues anymore.
Yep.
So I know that it's a larger scope of practice than what is understood.
Yeah. So like I said, there's a lot of specialties out there. A lot of chiropractors who specialize in a lot of different things, like you mentioned with the earaches. The crazy part about that is, scientists, not just chiropractors, we can't figure out always how things work. But we do get great results with some kids with asthma, some kids with reflux, some kids with constant reoccurring earaches. And again, a lot of that probably comes down to neurology because, doing adjustments or when we're modifying things, we're just getting the body restored back to its normal state, which, if the body is in its normal state or homeostasis, things are going to heal, things are going to work better, they're going to be more efficient. So there's chiropractors out there, that focus on pediatrics, and that's some of the issues that they focus on. The functional neurology, if I had the brain capacity for that, I would love to do that. Like I said, they're working side by side with, some of the top medical doctors in the world.
Wow.
There's actually a traumatic brain injury institute that's being built here in Dallas.
Really?
It's headed up by Parker College of Chiropractic. They're going to be doing some really great things with functional neurology. And what they're looking at is, people with Parkinson's, dementia, things like that, how can we better get how can we get their body functioning better? Not by dosing them with, certain medication and drugs, but how can we get them functioning better so that their symptoms will, maybe not go away, but be relieved, so that they can live a more normal or better, quality of life. We try to look more at the whole person as opposed to a symptom by symptom approach, and that's something functional medicine does as well. With me, I'm in my sports medicine background, I focus more on the soft tissue injury as well. So looking at the joint, how the joint's moving, and then also how the soft tissue's been affected as well. So I have longer treatment time. So in my office, you can expect not to just get a quick adjustment. We'll do a full assessment to really figure out what's going on with that injury. We would address, of course, the joint issue or the joint restriction that's going on with that injury, and then the soft tissue that's involved with it as well.
So when you talk about soft tissue injury and soft tissue treatment, what are some of the things that incorporate in that specifically?
Yeah, so most people, when they think of soft tissue injury, it's that acute, you sprain your ankle and that tissue swells up, or you get edema, swelling. It's not always that. We can talk about postural injuries as well. So prolonged sitting like this is going to cause some, some changes to that tissue. So most people will call these like knots. Okay, so these are called myofascial trigger points or adhesions. These are just tissue that doesn't quite slide and glide or doesn't quite move or do exactly what we need it to do. So if we can get that joint moving well, if we can get that tissue repaired and healing well, because one of the things you got to keep in mind, anytime you injure that tissue when it reforms or builds back, it's generally weaker, and that's going to be more prone to future injuries. So we want to make sure that tissue is lying down in the correct pattern. And that's one of the things we do with different like massage techniques or different instrument-assisted techniques to make sure that tissue is healing not only well, but correctly in the correct orientation as well. Believe it or not, if you're having a right shoulder issue, it could actually be from your left hip. So just weird things like that. And the same things happen with organs. So you know, it's not always, you know, as simple as where the problem is or where the pain is, the problem is.
Gotcha.
Because that's usually, honestly, 9 out of 10 times not the case.
Wow.
Where the problem is, where the pain is, the problem usually isn't.
Right. Like a referred pain.
Exactly.
Yeah,
referred
right.
pain or a compensation or something like that. So, you know, oftentimes, you know, I'll be working on somebody's hip and they're like, but it's my shoulder. And it's like, no, it's actually your hip.
Right.
So, and that's more my realm with the
Right.
sports medicine thing. But, you know, again, with the functional neurology and the pediatrics, you know, they're looking at the whole body to make sure that the whole body is functioning well. And, you know, even if you come see me, I'm not just going to, and you're having a bum shoulder, I'm not just going to work on your shoulder and just adjust your shoulder. We're going to look at the whole body. We're going to get your whole body adjusted, make sure that you're functioning well so that you can recover and perform well.
Okay, so tell me about, because I know you have sleeves over there, tell me about some of the things that you use that help athletes recover.
Yeah, so from my standpoint, as far as treatment goes, I do myofascial decompression. So if you guys saw Michael Phelps at the Olympics with the cup, most people call it cupping, right?
Okay.
So cupping is the Chinese medicine form of it. They used to use fire and they would just leave it on there. So we do a different version of it now where we're actually putting you through ranges of motion while we'll have that cup on you.
Wow.
What this does is decompress that tissue so we can get some fluid dynamics. We can get the tissue sliding and working and functioning better.
Oh, wow.
So we do some myofascial decompression or cupping here. We use instruments to help get into some of the muscles and work on the sliding and gliding of muscles, getting everything functioning well again. So that's called instrument-assisted soft tissue mobilization. Some people refer to this as Graston. It's a pretty big technique out there.
Okay.
So we do that here as well. We have percussion massage. And then as far as like therapeutic modalities go, we have electrical muscle stim units. We use complex units, which actually for a athletic or a recovery standpoint, they have recovery settings. So we can actually have you doing exercise while they're on.
Really? Wow, I didn't know that.
They have training settings. They have acute pain, chronic pain. They have a bunch of different settings that we can use depending on what's going on with you.
So what do they actually do? What is that?
Yeah, so the stim units, they run on different frequencies depending on what we're trying to do. You know, for like a recovery setting, they're trying to get those muscles firing a little bit so we can get some blood and oxygen back in there and we can push out some of the waste products that occur from, you know, exercise and things like that. As far as like pain goes, if we put you on like a TENS setting, which most people are familiar with TENS, basically all you're trying to do with TENS is have something on your body that's more annoying than the pain. So it's just an electrical signal that goes to your brain faster than the pain does. We have recovery compression boots. This is sequential air massage, which again helps bring new blood and oxygen into the legs, arms, or abdomen. And then this helps push out the old blood and oxygen and metabolic waste. Again, stuff that's, you know, created or formed from exercise or from injury. So if you're having an ankle, knee, hip injury, the boots work really well for that. We also have compressed ice, free sleeves. So generally when you slap some ice on your joint, you know, it's not very tight. Yeah, it's cold, but with our compression free sleeves, man, we get that really tight on that joint. So you get a little compression aspect too, and that ice, it feels like it just gets a lot deeper in there. For that analgesic pain relief.
Okay, so that helps with pain
relief.
the coldness helps with pain relief.
And then as you mentioned earlier, we do own and we're within or a part of CrossFit Watauga. So what we'll do with our patients once they're kind of out of that acute phase of pain, we get them over there. We're not necessarily doing CrossFit at that point, right? Or big lifts or anything like that, but we're doing therapeutic exercises. And that's where I kind of mentioned earlier, that's one of the big things to making sure that, you know, you can take care of yourself. You know, that's my biggest belief is, you know, I want you to be pretty self-sufficient. You know, from a business model, that's not a good idea. But, you know, from what I'm morally supposed to do, I'm supposed to get you feeling better. I'm supposed to teach you how to stay feeling better. So that's where we'll go over there. We'll do different therapeutic exercises, therapeutic stretching, things like that. We'll get you on a routine that you can continue at home. So again, you don't have to see me. You don't have to see a physical therapist. You don't have to see your medical doctor because you're not going to have pain if you keep up with that stuff. Gotcha.
All right. Well, thank you so much for sitting with us today. This was awesome. Good information. And if you all want to get in touch with him, I'm going to do a link right here.
R2P Watauga or r2pwatauga.com, and you can find us there. We're on Facebook. RP Watauga, I think, is our Facebook address as well.
Okay, very good.
Yeah, you can find us all over the web.
Okay, well, thank you. It was awesome sitting with you today.
Appreciate it.
All right.